I'm Dr. Ann Schuchat, the Acting Deputy Director for Science and Program at the Centers for Disease Control and Prevention, and really appreciate the opportunity to talk to the committee this morning. I'll be updating you about what we know, what CDC is doing, and some of the steps that are in place, and really appreciate the chance to testify with the distinguished colleagues. First, I just want to say that my heart and the hearts of CDC really go out to the people in the communities that have been affected here in the United States, in Mexico, and around the world, both directly from the virus and then indirectly from some of the interventions and the impacts they've had on families and communities. We know that our nation's 7.6 million workplaces and over 126,000 schools and other childhood settings have been facing the challenges of this outbreak. We share the concern of people across the country, and we're responding aggressively at the federal, state, local, tribal, and territorial levels to understand the complexities of this outbreak and to implement effective control measures. Our aggressive actions are possible in many respects because of investments and support of the Congress and in U.S. Pandemic Preparedness, which has provided us with many of the tools we're using to detect, track, and control the impact of this outbreak at CDC and at state and local health departments across the country. Influenza viruses are very unpredictable. It's hard to anticipate the course that this outbreak will have with any certainty, either this spring or in the fall, at the usual return of the influenza season. We do expect to see an increase in the number of cases, the number of states affected, and we also expect to see additional deaths and hospitalizations. We're carefully monitoring the severity of illness caused by this virus. While preliminary evidence is encouraging, we understand that this too could change. Amid this uncertainty, our goals are to be clear in communicating what we do know, acknowledge the uncertainties, be clear about communicating what we are doing and what individuals can do themselves to protect their families and their communities. Influenza arises from a variety of sources, and in this case, we've determined there is a new or novel influenza A H1N1 virus that is circulating around the globe that contains genetic sources from 4 different virus sources. We've been able, within just 2 weeks, to identify this novel virus, understand its complete genetic characteristics, and compare the genetic composition of specimens from U.S. patients to others from around the globe to watch for mutations that may change the properties of the virus and how it behaves in people. We've also very quickly developed and then deployed test kits for use in the widening network of laboratories that are responding to this outbreak. These steps, along with the capacity that is in place as a result of effective planning over the last few years, have allowed for the rapid diagnostics and epidemiology that contribute to a clearer understanding of transmission and severity of illness caused by the virus. These scientific accomplishments have provided the basis for an evolving set of responses that greatly enhance our nation's ability to address this threat. CDC has determined that the virus is contagious. It's spreading from human to human. It appears to spread with similar characteristics to seasonal influenza virus through coughing and sneezing, through human-to-human contact. Sometimes people may become infected by touching something that has the flu viruses on it and then touching their mouth or nose, but there's no evidence at all that this virus can be acquired from contact with pigs or from eating pork or pork products. Aggressive actions are being taken here in the U.S. as well as around the world. We're working very closely with state and local public health officials around the country on the investigation and on implementation of interventions such as infection control measures. We're providing both technical support on the epidemiology as well as laboratory support for confirming cases. We're also working with international partners on the outbreak, including a collaborative effort in Mexico, really the epicenter of the problem, to better understand the outbreak and enhance surveillance and lab capacity there. And we're working closely with Secretary Napolitano and our other federal partners to ensure our efforts are coordinated and effective. CDC has issued numerous health advisories for individuals, healthcare practitioners, schools, and communities, and these continue to evolve as our understanding of the situation changes. In fact, a key message from CDC is that there's a role for everyone to play in the outbreak. At the individual level, it's important for people to understand how to prevent respiratory infections. Frequent hand washing is a good idea. If you're sick, stay home. If you're sick, don't get on an airplane or public transport. Keep your kids home from school if they're sick. Taking personal responsibility can help reduce the spread of this virus as well as other respiratory infections. But the path of this outbreak is unclear. As I said, influenza is unpredictable, and we need to be prepared for the potential return of this virus in the fall, perhaps in a more severe format. It's important for public health officials to continue to think about what might be needed if the outbreak deepens in the communities where you work. It's also important for businesses, schools, and local governments to anticipate those types of changes. Schools and childhood settings, including Head Start and child care programs, play a critical role in protecting the health of their students, staff, and the community from contagious diseases, including this novel H1N1 influenza. About 1 out of 5 Americans spend considerable time in one of the more than 90,000 school buildings on any given school day. Millions of adults work in school and childhood settings, and many millions more are parents or guardians of school-aged children. While CDC has made scientific recommendations about how schools can deal with this virus, the authority for decisions regarding school dismissal resides at the state and local level. We at CDC applaud the collaborative efforts of schools, superintendents, Head Start and child care directors, county executives, mayors, governors, et cetera, who are on the front lines of this epidemic. The emergency preparedness work that communities had done before this outbreak has been essential in the response. That includes the 600 local education agencies that have been working with our colleagues in the Department of Education through their Readiness and Emergency Management for Schools program. Without that sort of considerable advanced planning and ongoing exercising, we would have been much less prepared for this outbreak and the ongoing response.
Dr. Schuchat, I'm going to ask if you can start to wrap up.
Sure.
Thank you.
Absolutely. CDC's NIOSH is leading the agency's efforts to minimize effects on the epidemic and working to disseminate guidelines. I do want to stress that as we learn more, we try to use the science to inform changes in guidelines and try to work collaboratively across government and with partners before we issue new guidelines. We in the government can't solve this problem on our own, and we do need the cooperation of other sectors. I just want to conclude by saying we don't know exactly where this virus will go, but we have never been as prepared as we are today based on the investments of the past few years. Thank you.